So, good afternoon to all of you, and thank you for taking the time to join us today. I think I recognize lots of names and faces across the screen, and very much appreciate the time that you spend with us in this series focused on building collaborations across campus and actually for our research teams, even beyond campus. Under the VPHS, my name is Jill Cizek. I report directly to Dr. Brashear, not as the Dean of the School of Medicine, but as with the hat that she wears as Vice President for Health Sciences. And I have the good fortune of working with all of the 6 health science schools at the university and have wonderful opportunities that come up like today, where I have the opportunity to meet and learn more from faculty even beyond the health sciences across the university and the tremendous recruits that we've brought to campus. And with that, I would like to introduce Dr. Kim Saxton. So I met Kim, I think about a year ago, and had a chance to meet with her, learn a lot about her background, which is very diverse in a lot of different aspects that tie to uh, the tremendous strengths of the School of Management, but everything from marketing, and she was recruited to run the behavioral research lab within the School of Management. Um, she did her PhD at Indiana University, and her publications go on and on and on. We're very excited about the opportunity to basically have her and Dean Ayer, who thank you for joining us today, Dean, speak a little bit about the tremendous resources that are on campus in the School of Management, um, and how we can partner with them. A lot of times, I think, and we've all discussed this in the past, we sort of see things within our schools and the resources, and don't recognize that there's a lot of other talents across campus. So with that, thank you, Dr. Saxton, for taking the time to prepare this for us today and for joining us. And we're looking forward to learning more about all that you're building and all that currently exists in the school.
Well, thank you, Jill. And I'm not 100% sure we're going to get to all, but we for sure are going to try and introduce ourselves so that there's some familiarity and we can start a conversation. And really, our goal for today isn't necessarily that we identify a specific project, but really just to introduce ourselves enough to start to have some conversations because we know that true collaboration has to be organically grown. So that's why I say I don't think we're going to get to all, but we're going to certainly try to introduce the faculty who are already doing work in healthcare and share a little bit about what they do. Share some broader resources that we have at the School of Management, because I think, as Jill said, a lot of times we're in our silos and we just don't know what's out there. And then we are going to open up an opportunity towards the end with a breakout room for you to go and talk to some folks and just brainstorm some ideas and begin to get to know each other. So as we go through it, you might think about, well, which researchers am I most interested in connecting with? Because we're going to divide people into breakout rooms, and then you can self-select to go into the breakout room of your choice and say hello and start a conversation. And so I want to start by trying to understand better who is here. So one of the beauties of the health sciences is that there are a whole lot of people in the health sciences, and sort of the challenges of the health sciences is that there's a whole lot of schools. So I think I put up a poll, and if you would mind sharing which school you're at, so that we can get a better sense of who's here with us, medical, dental, nursing, pharmacy, public health, social work. And if I missed something, do let us know that we've missed that. So going to give you guys another 10 seconds. I think we've got maybe 2/3 of you have answered. So let's see. I'm going to end this poll and let's see our results. And so we've got a few folks from dental, the majority from the Jacobs School of Medicine, someone from nursing, someone from public health, and then other schools. And then the second question I had was, have you ever collaborated? And so it's great that we can see some of our existing collaborators and to know that we have a number of opportunities to make some new friends. So thank you for that. So next, I'd like to introduce Dean Ayer and give him a chance to share his vision for this collaboration. I know he's worked very hard to get this started, and all of us spend a lot of time with the the health sciences schools trying to get to know you better. So Dean Iyer, go ahead and share your ideas.
Thank you, Kim. Thank you, Jill, for this opportunity, and thank you to all of you on the call. Um, Purely from a school of management perspective, healthcare is about 17 to 18% of the U.S. economy. So we have to understand healthcare. Just by way of anecdote, several years ago, I was doing a consulting project, which at that time Chrysler, and we were working on procurement. And then somebody walked in and said, "Why are you thinking about procuring widgets? Why don't you help us procure healthcare? Because that's growing much faster as we have an aging workforce than widgets. So help us be smarter there." So this is something we would love to collaborate with. I think the specific way to frame the role potentially of the School of Management is there was a study that came out last year which said that the cost of back office functions in healthcare, which is all the billing and the coding and the insurance claims, etc., if you just take that completely separate from healthcare, that's a $1.3 trillion footprint. So, and many of you know that, close to 50% of the requests for reimbursement are rejected. So you got to do it again. And the net benefit of AI is that people who reject have adopted AI faster than people who submit. So more claims are going to be rejected for some little detail because it's optimal to reject. So this is, in some sense, one way to think of it as a game. Another way of thinking of it, it has material costs for healthcare systems in Illinois. The accounts receivable days to pay has crossed 420 days. Think about the impact. So all these are things in which this study from the Wharton School, from Stanford's Business School, claims that these are places where use of AI will streamline things and may actually free up resources that really should be in the front end and engaged with the patient and the improvement of the patient rather being stuck at the back end. So that's one. The second is, uh, Professor Milind Soni is our department chair in the operations management and strategy area. That's the same department I'm in. So those of us who are in operations think about healthcare as an operation where there are bottlenecks, there are delays, there's inventory, and there's all that which creates costs. So that's another area which is related to the healthcare, but really is a supportive function. So even before we try to think about applications that involve connecting with the patient and the doctor interaction, there are many other things that can be facilitated to make a lot of that easier, more streamlined, etc. So this is the reason why there's a lot of interest in applying various tools we have: optimization, behavioral economics, machine learning, AI, all of these things. There are a bunch of faculty very eager to collaborate. So with that, I'm going to return this back to Kim so that you get to learn a little bit more about what each of our faculty do. Thank you again. And if there's anything we can do from a dean's office perspective, please reach out to me. I know Allison has been a wonderful collaborator and very supportive of us finding ways to collaborate. So we look forward to collaborating. Thank you. Kim?
Thank you, Ananth. And to that point, because we're going to get started, I wanted to give you guys some context. And so we have a document which I think Jill is going to post in the chat. And you're always welcome to put something in the chat. I want to give a shout out to Pharmacy. I see Pharmacy is here. I killed the poll too quickly, I guess. So glad to see there's some representation there. And I will try to address whatever issues come up in the chat. But what we have is a little overview of the faculty and the work that they've done in the healthcare arena that we can share with you. It has their links to their profiles and their emails. So if you want to follow up later, you'll be able to do that. But given how much we love AI, Dean Ayer put that document into a generative AI, and it came up with the themes of the work that we've already done. And so I want to start to share those themes. And when we looked at it, we were like, well, you know what? This is actually a pretty good list. The AI did a good job. So let's start with the patient. So we've done work on influencing preventive healthcare behaviors and promoting patient engagement. We've done some work between physicians and patients on how to improve communication, more focused on the patients, on the physician side. We've done work in enhancing healthcare operations, improving patient flows, resource optimization, which of course leads us to the technology that is now the heart of healthcare. And how do we leverage technology? What else can we do with technology? And then in a bigger picture, we also look at innovation and entrepreneurship in healthcare, that whole idea of getting things from the bench top to the bedside. And so there's roles that we can play with that. And what I want to do next is just share a little bit about each of our faculty. I'm not going to read to you what is on the slide. I'm just giving you a heads up, and I'm going to try and give you a brief overview and give you a chance to read the more detailed information that's on the slide. And again, remember, we're going to have breakout sessions in the second half. And so, you're kind of thinking, who do I want to talk to? Who's got some ideas and issues they've already looked at that's really close to what I'm interested in. And the first faculty member we have is Haimanti Dutta, and I hope that you can see that Haimanti is an expert in machine learning and natural language processing. So there are a lot of healthcare applications that can use both of these tools. In fact, she teaches a class in healthcare analytics, which the students use these tools to analyze EHR data. So her grant-funded research has used these tools, and in one particular application looked at intracranial EEGs associated with epilepsy. And so she has collaborated with others in the healthcare area and is really interested in doing that more. Second, we have Indranil Goswami, who's also in the marketing realm with me. His focus is on decision-making and judgment, and in particular, how to leverage nudges and incentives in order to get people to make the choices that we really want them to make and that they should be making. And he shares here some results of a study that he did, in particular looking at using incentives to help people get healthy behaviors. And you can see pretty clearly that in the incentive period, the healthy behaviors went up. But one of the things that's also really important is that, contrary to popular belief, they found that once the incentives are taken away, there wasn't a detriment to the original behavior, and people just return to their normal levels. We worry that if we pay people, then we don't pay them. They stop doing the things that we want. But to see that it bounced back to regular levels is a great policy implication. So again, where nudges and incentives might be part of your research program, he could be a really helpful asset to you. Kyle Hunt has been extremely successful working on grants that use multidisciplinary teams to tackle tough modeling programs. So during COVID in particular, he worked on a model of predicting patient outcomes, including things like length of stay, ICU admission, mortality. His focus now is more on clinical trial planning and how to optimize and accelerate that and increase patient engagement. So that's an area he's thinking about, but there are a lot of other areas related to that he would also be a great asset. Next, we have Ramesh, and Ramesh has been a pioneer in health information exchanges. And in particular, he does a lot of work in healthcare optimization and predictive analysis. And I think in many healthcare fields, we want to move from data to predictive data. And there are a number of diseases in chronic management where this could be really important. In particular, he's focused on improving patient outcomes via healthcare resource allocation, operational efficiencies, and even causal modeling of healthcare information technology. So a deep, and he's been a longtime collaborator across the school. I'm sure many of you are well aware of him. But next up, my own background. I've looked at a wide variety of issues in healthcare. In fact, I started my healthcare stay was at Eli Lilly and Company. And honestly, we were using segmentation to identify the physicians and patients that would be most motivated by our messages. But my academic research has extended from that into how to create motivating messages that people feel target them, and even different theories of what kind of information needs to be communicated when. In particular, under COVID, I worked closely with a field experiment with a public health department to support the launch of the child COVID vaccine. And we were able to identify ways to improve the uptake of the child COVID vaccine at its launch. Todd Saxon is my partner. So the last, just to be candid, the last names are the same for a reason. We do a good deal of research together, but his focus has been more on innovation in healthcare and how to move those innovations, as I said, from the bench to the bedside. He also is in charge of launching a graduate certificate in life sciences entrepreneurship from the school. And so anything related to commercialization and other topics, he would be your best candidate. Milland, as Dean Iyer mentioned, is the chair of operations management. He has a distinguished research record in transportation and supply chain logistics. In healthcare, he has analyzed emergency room logistics scheduling and tried to optimize it. I also discovered by talking to him, he's quite an expert on rural health in other countries like India and Africa, and designing policy approaches to align incentives to intended outcomes. So he is also collaborating with Kyle on clinical trial planning and optimization. So make sure you get a chance to talk to him. And then we have Raj Sharman, who is particularly interested in building AI technologies that contribute to patient safety and patient empowerment. He has worked with Dr. Ranjit Singh, Dr. Chet Fox, and Dr. Raul Vasquez on projects that are already well on their way. And he's enthusiastic about a wide range of other topics related to the leveraging AI and social networks in the delivery of healthcare. And so those are our primary faculty who are already engaged in healthcare. And there are plenty of other places that our faculty could engage, but we wanted to start to get you familiar with some of the folks who have already determined that healthcare is a topic that they're interested in. And of course, as the director of the Behavioral Research Lab, I want to share that we have a relatively new lab. Some folks from across the College of Arts and Science came over to visit, and they were like, oh, this is a snazzy new lab. It is. We're just opening it up, and we are expanding the capabilities. So we have a lab with 20 computer stations so that we can manage a reasonable size sample at a time. What we're adding now is biometric measures, including eye tracking, facial coding, and galvanic skin response. So that helps us understand what people are paying attention to, the valence of that attention, and also the magnitude of that attention. And as part of increasing those capabilities, we're actually sponsoring a demo day with iMotions, which is the platform for the biometrics, on Thursday, December 12th of this year over the lunchtime hour. There's a QR code here, and you are welcome to RSVP. We're going to have some hands-on demonstrations, 3 sessions where you can, run some stimuli on yourself or watch it being run on somebody else. We're going to have some talks to share more broadly what these measures can do, and then another set of hands-on. So if you can join us, we would absolutely love to see you. To kind of tie it all back together, there's really 4 ways that we can think of off the top of our heads, and we're not restricting it, but these are some things for you to think about. That we could collaborate with you. First of all, you could leverage our methodological skills in existing projects. And I want to make sure you had a list of those skills, from machine learning and statistical learning models to combinatorial and computational optimization, which, if you don't know what those mean, that's okay. We'll help you. It means that we know how to model data. We know how to get data through experimental design, secondary web scraping, game theory, econometrics. There's lots of ways that we can help you. We'd also be really excited about developing new projects and grants with you. And I also want to point out that these don't just have to be grants for funded research, but also we can help you with the SBIR, STTRs, because of that whole commercialization part of that proposal. Sometimes you're looking at multiple interventions, and cost effectiveness analysis might be important. That's another place we can help. And I'm going to point to it in a minute, but we also have a strong cadre of students that we're training in all of these techniques, and there's ways that you can access them as well. And so before I move forward, what I'd really love to do is to take a brief pause and check in with my School of Management researchers and see if I left anything out or there's anything that they would like to add as I went over the brief profile of each person. So team, is there anything you'd like to add or say? Millen's thumb up. Are you wanting to say, or are you all good? All good. All right. I do want to share that one of my colleagues, Indranel, approached me last night to talk about and think about predicting who might be at risk of maternal mortality. And so if that's an area you're interested, they've been doing some research and they've got some thoughts about how to analyze some data that would lead to a predictive model. Milind, I'm going to go back to you because I think you did want to say something.
No, no, no. My was thumbs up was, yeah, you've covered it all, at least as far as I go. But
All right. Anything else? If not, I want to share some other resources from the School of Management and then give you guys a chance to ask us questions and get us into breakout rooms. So,
Kim, before you start, could you just give us the name of the person interested in maternal mortality?
yes, it's Indranil Goswami.
Okay, thank you.
Absolutely. All right, some other resources that we have at the School of Management you might not be aware of, but you could also access. We do have a Center for Leadership and Organizational Effectiveness. We call it Chloe. They have a couple of programs that you can learn more about online, the leadership coaching certificate, and they have a leadership accelerator, but they also do custom programs. So if you have a need for any leadership training or you have a team that could use some leadership training, please feel free to reach out to Dorothy and Chloe as a place to help you. We also have a Center for Entrepreneurial Leadership, and I know a couple of folks from the medical school have participated in programs over there where they've had an idea they wanted to commercialize or a business that they wanted to move forward. So the CEL is what we call it, and they do quite a bit of programming to help people develop and build companies. And so it's also located in the Gateway downtown, so it's very accessible. So if that's something that's in your interest, please do reach out to them. We've had the good fortune of earning a couple of recent grants that are leading to some other new centers. Some of you may be aware of the work with Dominic Stiletto and the Hupman Woodard Medical Research to build an AI-assisted biomedical research tool. But we also recently won a grant through the iSmart Corridor semiconductor technology that is going to go between Buffalo, Rochester, and Syracuse. And we are building a new center for supply chain analytics that's intended to help small companies pivot into semiconductor manufacturing. And so we are standing up a center around that. We have two other centers in the planning stages for this year, the Center for Marketing Analysis, by taking marketing data streams and understanding some of the key business issues associated with them to promote loyalty and engagement, and also the Center for AI Business Innovation. These centers are really happening as a result of new hires. We've had a number of established faculty join us and are trying to recreate centers that they've had in other places. So there's more resources coming from there. And then the last thing I wanted to talk about before we kind of get into our collaborative issues is we do have a student community projects, and we've done a number of projects with the medical groups associated with Jacobs. And if you have a project, these projects are going to kick off in February for the spring semester. You can literally go online to this this address, and you can enter your project in, learn a little bit more about these projects. But essentially, particularly in data analysis and data visualization, we can put teams of master's and undergraduate students on solving some problems that you have that are just sitting around because you didn't have resources to do it. So give that a thought. So we already had one question about who's interested in a predictive model for maternal mortality. Do you have any other questions, broad questions for me or any of our research to start with? If not, I'm going to get us started into breakout rooms.
Hey, Kim, can I just say one thing to the faculty here? It's
Yeah.
Phil Glick. So if there are any mid-career people here, besides getting these little certificates, I would really recommend you think about doing an online MBA. Even if you're in public health and have a master's in public health, the skill sets you will learn from getting an MBA are amazing, and they will help you throughout the rest of your career. Jen might want to talk about getting students MBAs, but I really have to say that getting a MBA in my mid-career was a career-changing opportunity for a surgeon. People assume that when you're a good clinician, you're a good teacher and a good researcher, but no one has any idea how to lead unless they're taught how to lead. It's not as intuitive as you think. And reading balance sheets and financials are really important if you want to do some leadership. So just consider it. I think they've made it really easy to do an online MBA now. So just think about it. That's all I have to say, Kim.
Awesome. Thank you. Appreciate that. And if you want to learn more, see Phil Glick. And if you need some support or help from us, we are absolutely willing to do that. I saw something in the chat about sustainability, and I do think that most folks are keep sustainability at the forefront. That is one of the 4 strategic pillars at the School of Management. And we're even looking at some possible centers in supporting sustainability in the workplace. So our ops folks and our MSS folks might be really particularly helpful there. Financial sustainability. I was thinking of the ecological sustainability. I'm sure that pretty much most business faculty can help you think about some of those ideas. Anyway, okay.
So Kim,
Yeah.
I do have a question if I can interject. So I posted the document for everybody and you ran through a lot with a lot of different faculty who have tremendous strengths. If an investigator from the health sciences is looking to take on a new project that either they're not sure where it fits or it doesn't necessarily fit into one category, who's the appropriate person over in the School of Management to reach out to maybe get a recommendation of a faculty member? We try to do the best that we can. Dr. Brashear likes to say, hit the easy button for researchers so that they just don't have to go and scour the UB website kind of thing. So
Yeah, so I think the easy answer is probably you can email me, mksaxton@buffalo.edu. I'm happy to be the conduit. For those who don't know, I have a part-time affiliation as an adjunct with the School of Medicine, so I'm sort of the easy one. I could say Dean Iyer, but the reality is we know that might take a little time to get your email response back because there's a whole lot to triage every day. So it's probably easier to reach out to me and I can talk to him and others to see what makes sense. There was a question in the chat about services. The student projects are free of cost payment, but we do need your time and your data. So to be clear about that up front. I think if there's an opportunity for publication, many of our faculty are already doing research that needs to result in publication. So I think some things can be done for co-authorship, and that can be worked out as these organic collaborations start to proceed. If there's places where grants can be written to help cover people's time, I think that's another place to look. But we don't have like a fee-for-service model in our head. At some point, I'm working on a fee for service for the behavioral research lab again, but more about Could it come out of grants because we have technology? And if you haven't worked with UB before, UB struggles to figure out what the charges might be. So we don't have a charge sheet yet, and we're not 100% sure when that's going to happen. So at least for now, it's free until we figure some of these things out. I would say the more important thing is let's start collaborating. And if we need to get some costs covered, then let's start collaborating about how we get those costs covered. So I think we're more excited about getting the ball rolling than worrying about a line item charges. Any other questions before we move to breakout rooms? These are all great questions, and no question is off limits. As Kyle pointed out in the chat, we do have experience writing grants for the NSF, the NIH, DIH, DOD, and the list goes on. We probably have the same hit rate as everybody else, though, right? So if we really want to do something, that we need to get more grants in the hopper faster, and we're willing to use all the UB resources to do that. SBIR, STTR, also for commercialization. So yeah, we're not afraid of grants to help us get where we need to go. All right, so we've got 3 breakout rooms. We're going to have Ramesh, Raj, and Haimanti in room 1, Milan, Kyle, and Indranil in room 2, and Todd and I will be in room 3. I'm going to create these breakout rooms, and then you are free to join those breakout rooms and start a conversation. And again, my email is mksaxton@buffalo.edu, and you can reach out to me and I can help you triage any ideas you have.
Kim, this is Nancy. I just want to say this has been terrific. Where have you guys been all my career? I mean, this is wonderful. Thank you so much.
Well, thank you. I think you may not be aware that the school of management hired 17 faculty this year. And so I think we've had a bandwidth problem perhaps in the past. And now we have a bunch of seasoned faculty and some young faculty, but more seasoned faculty that are rip-roaring to go. And so here we are.
And just to add, like as part of the supply chain analytics center, we want to develop a vertical in healthcare service operations and healthcare analytics. So that's the goal, that eventually if we have enough projects going, we can consolidate all the effort there. So
Kim, are you expecting anybody to come back, or they can stay in the breakout rooms and just move on from there?
I think that you can stay in the breakout rooms and we can just move from there. So we appreciate your time. Thanks for lunch. Mike, I'm happy to introduce you to Dorothy at Chloe. I have just been waiting for you to ask for that introduction. So I'll do that at the end of this session. I didn't want to overwhelm you because I knew you were new too, but I already had lined that up. So I got your back.
Well, Kim, thank you so much for doing this. And as you heard from the whole crowd, and you can see all of the questions that are coming up, I think you're going to get lots of interest as a result of this. Thanks for taking the time to do it.
We're thrilled to do it. And I'm hoping eventually, Jill, I'll have some office hours over at the medical school. I think we're still finding a place for me to be. But at some point, perhaps I'll do that, and maybe I'll bump it.
Crash here anytime that you want.
All right. Thank you, Jill. All right. I've opened the breakout rooms. Again, Ramesh, Raj, and Haimanti are going into 1. Milan, Kyle, and Indranil are going to be in 2. Todd and I will move into 3. I'll let Todd hold down the fort until I get a chance to get in there. And so jump in a breakout room and let's see what conversations we can have.
All right. You go lead your session. Thank you for doing this. It was awesome.
Thank you.